and a warm welcome to all of you joining us today on Homeopathy 360. I am Dr. Noori, Senior Editor at BHMS. We are honored to host a very special session, Competency-Based Learning, with a new edition of Homeopathic Pharmacy, marking the upcoming launch of the fourth revised edition of the much acclaimed D.D. Banerjee's augmented or revised textbook of Homeopathic Pharmacy. It is our privilege to welcome the Chief Editor of this landmark edition, Dr. B Ram Jyothis. Sir is currently Professor of the Homeopathic Pharmacy at Athusramam NSS Homeopathic Medical College, Kerala, a gold medalist in MD Pharmacy. He is a prolific author, researcher, and a widely respected contributor to national academic and regulatory bodies in the Ayush ecosystem. Sir holds prestigious professional affiliations, including lifetime membership of LHMI, IHMA, and GHF. His academic vision and leadership have played a pivotal role in reshaping this edition to align with the CBDC, ensuring relevance, clarity, and depth for BHMS students and faculty alike. Several important new topics have been added in this upcoming new edition, which Sir will discuss about. And yes, today's session also includes an interactive Q&A with Dr. Jyothis himself. So please get ready with your questions. Without further delay, let's welcome the man behind the mission, Dr. B Ram Jyothis. Sir, it's an honor to have you with us today on Homeopathy 360.
Thank you, Dr. Noori.
Sir,
nice introduction.
It's our pleasure. I'm sure the audience as well as myself are curious to know about the story behind this important edition of the textbook. What was the motivation or need you saw that led you to take the role of chief editor and update this landmark work? Please share with us.
Yes, definitely. So at the outset, I would like to extend my warm welcome to all respected teachers of homeopathic pharmacy. Let me share my slide. Can you see my slides?
Yes, sir. Yes, sir, we can see that.
Let's see. So in this beautiful evening, we are gathered for a webinar on competency-based learning with new edition of homeopathic pharmacy textbook. That is D.D. Banerjee's augmented textbooks of homeopathic pharmacy. So before going into the details of the book, let us share something which are common concern for all of us. So last about 2 years, I feel so, we are following the competency-based curriculum. We are striving to achieve the competency for the students. Though we are all new to this curriculum, paradigm shift in the curriculum. Currently also we are learning much more about CBDC. There are many challenges and opportunities as well in this new curriculum because we are teachers. Teachers also are new to this particular new environment of learning, teaching. So what we learned in these 2 years, let us share, and don't think that it is a one-way webinar. After discussing a few things about the CBDC and the new textbooks, the content of the book, we'll have an interactive section where we share each other with the possibilities, the opportunities, the difficulties which we face during our classrooms. And it is about a mutual learning process. So the highlight of CBDC, as you all know, when Homeopathic Education Board of National Commission for Homeopathy, when they launch a new curriculum, basically any curriculum is rooted for society's healthcare need. So also, according to our National Education Policy of 2020, all the higher education's curriculum has been revamped. So also in our homeopathy also, a competency-based dynamic curriculum prepares a graduate cater the need of the society. And I feel that this curriculum ensures achievable outcome with respect to the modern educational methodologies. And we all know that this particular curriculum mandates for skills, ethics, knowledge, and development. So we all know it is not a teacher-centered process. It is a learner-centered process, as you all know, because Education Board, National Education, Homeopathic Education Board, they have conducted several workshops. Even universities conducted workshop last 2 years. And we all know about CBDC now, that it is a learner-centered process. And how a teacher can be a facilitator. So stakeholders needs a sensitization for an effective curriculum adaptation. So when we compare competency-based medical education and competency-based dynamic curriculum, in modern medicine, they have several nodal centers throughout the country, regularly conducting workshops, seminars, CMEs. But in homeopathic sector, we know there are very least reorientation training programs or CMEs. Even though our current CME is based on the former syllabus and curriculum, it's not updated so far. So there are more difficulties when we face when we trying to implement CBDC in our colleges. And definitely, many teachers share their concern over the faculty shortage, time constraints, many things. See, we have conducted a survey study, a cross-section study among teachers all over India. Even though it was a pilot study, it was already published in a journal. It says that teachers are not equipped to adopt this particular curriculum because of several reasons in the beginning. But right now, many teachers, 80% teachers are readily acceptable, but there are still some difficulties. Teachers training is very crucial in adopting any new curriculum. It's not only a competency-based dynamic curriculum, any new transition from the traditional way of teaching. So I am appreciating BJN to initiate a humble step towards the sensitization of this particular new curriculum and how this can be utilized or it can be applied to teach homeopathic pharmacy in accordance with the fourth edition of D.D. Banerjee augmented textbook of homeopathic pharmacy. How we can use this particular textbook in order to deliver the competency needs for the students, how we can act as a facilitator in support with this textbook. So that is what today's topic focused on. So before going in detail of the competency based education or curriculum, let us see what should be a competent graduate of homeopathic student. So we always say about competent or competency. what you understand by the term competency? So it is a capacity to apply the knowledge or skill or values to a successfully perform professional tasks in a definite context. To simplify, it reflects not only what a person knows, but also how effectively and responsibly they can use it in a real life scenario. So unlike the traditional education in homeopathy, where it is knowledge centered, now the competency based education is focused on knowledge, ethics, skills, and values. Then only a graduate becomes a competent. Now, the competency in homeopathic pharmacy, what does it mean? It means not only knowing the theory of pharmacy, but also being able to skillfully and ethically apply this knowledge in practical, clinical, and regulatory context. So all these things we are studying in homeopathic pharmacy. So it ensures that a homeopathic graduate is capable of preparing or identifying, preparing, dispensing, or explaining the medicines with scientific accuracy and professional responsibility. So let me introduce to a model of competency in learning. It was called Dreyfus model of competency learning, where Stewart and Dreyfus described how learners acquire skill through 5 progressive steps or stages. And this particular model is used in medical education to explain how a student evolves in a beginner to an expert in performing a professional task. So our objective is where in this stages, evolutionary stages, where a graduate can be placed, where postgraduate can be placed. So according to this evolutionary classification, it evolved from novice, advanced beginner, competent, proficient, and expert. So now the curriculum builders, they kept the graduate, the BHMS graduate under competent. Now, what do you understand by competent? As I said, a competent is a person who applies the knowledge, skill, and value successfully to perform the professional tasks in a definite context. That means once the graduate is out of the college, we should perform the skills and knowledge in a needed circumstances with all the accuracies. So we are ensuring the graduate to keep a competent graduate. So that is what you mean by a competent. Now, what is a novice? So once a first year BHMS student, a student joins BHMS course, he don't know anything about the syllabus or the subject studied. So he relies only on some rules and instructions where the teachers has to be given. So there is no practical judgment for a novice or a beginner. For example, a first year student learning the theory of trituration or potentization from textbook, we learn from the textbook, read from the textbook. They can list the steps, only the steps of preparing a mother tincture, but cannot actually perform without the guidance. So he can read it. So he cannot perform a task without the help of a supervisor. Now, advanced beginner, he's having an experience but begins to recognize the patterns but still need a supervision. So advanced beginner knows something, is a knowledge, but the skill he has to develop under the supervision of the instructor or a teacher. So if you give us some examples, say students performs a trituration or a dispensing of medicines in the lab under the teacher's direct observation. So teachers can give an inputs how we can improve it. So either or else they can weigh the drug or mix it or triturate, or they make errors in the proportion of labeling. So errors can be there for an advanced beginner. So after repeated training, the graduate becomes a competent person. So a competent person can plan or execute the task independently with consistency, still deliberate but reliable. So once he becomes an advanced beginner to competent, he is able to do the task independently. So that is what we expected from a BHMS graduate. Now, a proficient, he sees a bigger picture and adopt variations and anticipates vivid outcomes. That means if any change in this procedure, he can manage to. For example, an intern after completing the course, he becomes an intern, and in a hospital pharmacy, he can give uh, the tinctures or any medicines, but sometimes he observe that there is a sedimentation. So he's having the insight that before dispensing the sediment or the mother tincture, he need to filtrate it, because sometimes the sedimentation can be a natural process in the tincture, mother tincture. So we need to filtrate and give. So this insight is a proficiency. So, or sometimes he find that this particular bottle is not suitable for dispensing, so he can change that. So that is the insight he got from the proficiency. Now, expert is the highest level of skill acquisition, and expert perform the task intuitively with innovations and minimal conscious effort. There is no conscious effort, it will automatically come in an expert. So what we expect, the skill acquisition we expect from a postgraduate is the expert level of proficiency. I mean, the competence. So this is what we expect from the different levels of graduates and postgraduates. Now, about the curriculum, it built a foundational understanding of homeopathic pharmacy principles. It emphasizes a combining theoretical knowledge with hands-on practical experiences, and course outcomes aligned with national institutional education goals. I'm not going in detail about national goals and institutional education goals, because all the teachers are well versed with these goals. It is there in the preamble or the introduction section of our curriculum. And now the finalized syllabus ensures the achievement of course and outcomes, course and program outcomes. So we all know that a program, BHMS program, has an outcome, and each course in the program. So the subject we teach in the BHMS is called as course. So each course, like anatomy, physiology, or homeopathic pharmacy, mathematics, all these are courses. So each course having certain outcomes, expected outcomes. So we are ensuring, the teachers are ensuring that students are come up with the course output perfectly. Now, coming to the different goals and how they are mapped together. So I hope that all have come across the CBDC introduction chapters, introduction to CBDC syllabus and curriculums. So there we can have, you might have read about the national goals. So there are certain dimensions or certain attributes which are expected from a homeopathy graduates. So these derivatives or these attributes are derived from the national goals. And according to the CBDC curriculum, a graduate should have attributes like you should have a knowledge for homeopathic practice. That is the very first attribute a graduate should have. Then patient care, interpersonal and communication skills, professionalism, practice-based learning and improvement, then health care systems, then scholarship. These are the 7 attributes a graduate, homeopathy graduate should have. So I'm not going to define everything. You can read it from the introduction part of curriculum. And these attributes plus entrustable professional activities, that will give a program objective. So after BHMS, what a homeopathy doctor should be is given. It's a collective composition of graduate attributes and entrustable professional activities. So once we formulate the program objectives, next individual course objectives have to be formed. Now, this program objectives, these are the what knowledge or skill or attitude a graduate should have at the time of graduation. So that is what is called as program objective. Now, the program objectives of professional disciplines are identified by national level by concerned agencies. So here, the National Commission of Homeopathy, they define certain objectives for BHMS programs. So these objectives are given in the introduction chapters of CBDC. And from the objectives, we are framing the course objectives. So course objectives are the statements that describe what students should be able to do at the end of each course. For example, after the first year, what are the outcomes a student have to achieve? Anatomy, in terms of anatomy, or physiology, pharmacy, veterinary. So sometimes some courses are extended over years. For example, veterinary and organon, it will be there for all the 4 years. So distant course objectives over the entire teaching program of the subject has to be valued. So that is about the course objective. Now, from the course objective, we need to move to the unit objective or specific learning objective. So what is a specific learning objective? So here, what a students should know or able to know at the end of any learning session. So each class, every class should have some specific learning objectives. Now, these objectives are written in such a way that whoever reads the SLO, the specific learning objective, would have a same understanding that a person who write this objective. And that means there should not be any communication gap. So the writing of specific learning objective is very, very important. And it is very precisely written, very comprehensive manner. And that is the reason why SLO was written specifically and exclusively as a unit of learning of one of the domains of the Bloom. You might have heard about Bloom's classification of learning objectives. I'm not going in detail about this Bloom's objectives. It takes long time to explain it. But if you read the introduction chapter, you can easily get it. And each Bloom's domains are then again mapped with Gilbert's levels for easy, understandable, comprehensively manner. And this will ensure that a learning that is expected is clearly communicated among all those who refer it. So that is why in our competency table, everything is specified. The generic competency, specific competency, specific learning objective, Bloom's domain, Miller's pyramid, Gill's levels, then teaching learning methods, assessment, everything is mentioned in our competency table. Now let me explain about our course objective of homeopathic pharmacy. At the end of the course, the homeopathic pharmacy, the first BHMS student should be able to explain the principle that governs the homeopathic pharmacy, discuss the pharmacognostical basis of homeopathic drug with respect to their identification, nomenclature, source, part used, method of collection and preparation, prepare homeopathic medicine from their respective sources according to different scales, method, potentization on small scale in the laboratory. Describe pharmacology of homeopathic drug with respect to the types of drug action, sphere of action, pharmacological action of homeopathic drugs, integrated with homeopathic medical, anatomy and physiology. Relate methodology of drug proving integrated with the organ of medicine. Apply the principles of homeopathic posology in different healthcare settings like OPD, IPD, integrated with organ of medicine and homeopathic medical. That is why we are having a clinical posting in pharmacies and in OPDs and in IPDs. State the methods of standardization, quality control of homeopathic medicine to ensure the genuineness of homeopathic medicines. Explain the principles of pharmaconomy, dispensing and preservation of homeopathic medicines. Engage principles of pharmacovigilance and adverse drug reactions in relation to homeopathic medicines. Write an ideal prescription. Evaluate the scope of research in homeopathic pharmacy in context of recent advancements in the pharmaceutical sciences. So this particular topic is a new thing which is included in this new curriculum. So research in homeopathic pharmacy. So in our curriculum offers small research project also. It should be incorporated in our curriculum. So these are the course objectives you can find out in the curriculum. So now the competency table allow us to define learning objectives and specific learning outcomes per topic. So when you enter into the class, we have an objective. We have an objective. When we come out of the class, we have an outcome. So that is what is required as per the curriculum needs. So in between what we do, so we act as a facilitator according to the new curriculum. And how our textbook in homeopathic pharmacy can offer this task, how we can act as a facilitator, how we can act as a supporter for a learner. So this textbook of D.D. Banerjee's augmented textbook of homeopathic pharmacy, we have defined or included everything what is given in the course objectives and even beyond the what is given in the course objectives. Now, this SLO, specific learning objectives, are required with generic and specific competencies. Now, what you understand by a generic competency? A generic competency, in a broad sense, so professional performance is shown through certain visible qualities with learners gradually absorb and make their routine behavior. So generic competencies are not specific. They are broader in approach. So these are the competencies or the qualities reflect the ability and standard of the profession. So if a doctor become professional, he should have some generic qualities or generic competencies. And these are the general essential abilities that every homeopathic doctor are expected to gain through their training. So throughout the course, throughout the program, the curriculum is designed in such a way that once a graduate is out, he should equipped with certain competencies. So one of such competencies is general competencies. For example, some skills like gathering information or identifying problem, gathering the information or segregating the knowledge or definition of a problem or a problem solving. All these are generic competencies. So in short, a generic competency represents the broad set of abilities that form the foundation of professional practice. And be in mind that generic competencies are not specific to any specific task, like preparation of, in the context of homeopathic drug, identification of plants, or identifying as a particular vehicle for preparing particular medicines, or the knowledge he gained to select a particular potency in a particular case. It is not specific, but these generic competencies are broad set of abilities a professional need to have. That is what is mentioned. So you can refer to the curriculum competency table for that. Now, determine the Miller's pyramid level. So before going to next, specific competencies. So as I said, specific competencies are more focused. These are the focused abilities that students are expected to gain in a particular area of expertise. So here we can say learning a potentization method, or preparing mother tinctures, or mastering dispensing techniques. All these are specific competencies. Unlike generic competencies, they are discipline specific and directly linked to the student's field of study. So these competencies are focused on specific skills, whereas generic competencies are required for the professionalism of a graduate after passing out the course. So these are the difference between generic competency and specific competency. Now, about Miller's pyramid level of each SLS. Now, we come across the Miller's pyramid. You may be knowing, I just have a glimpses of Miller's pyramid. You are well expert with this competency table now, but still I am going to give some glimpses about it. We know that Miller's pyramid levels, the levels of competency, they are the knows how, shows how, and does. So here, knows means it is a basic level. That is, a learner has a theoretical knowledge. The purpose of Miller's level pyramid levels of competency is to what extent students should learn. This is usually a difficulty among the teachers in the traditional way. In the previous syllabus, I personally have some difficulty in some specific topics like drug proving. So what extent a student have to learn, or with regards to standardization. So up to what level a student should learn. Whether the student have to learn all the instrumental method, or a student should learn only the name of the method and what is the utility, or the entire process, entire standard operating procedure of the standardization process, especially instrumental methods. So these was a difficulty among some teachers, and where to stop. So that was, so now it was that task is over, because we know at what level the students should learn. So it is about the knowledge. Now, knows how. Here the learner understand how to apply that knowledge. Now, from the knowledge to how to apply knowledge. For example, I will give one example for all these levels. Suppose a students know about what is a potentization, the definition of potentization, the scales of potentization, the methods of potentization. Now knows how a students can able to explain what is a potentization, what are the steps for trituration, what are the steps for succussion, step by step. So he knows how to do it. Now, next level is shows how. Now here, the learner demonstrates the skill in a controlled or simulated setting under the supervision of a facilitator. So here, the same example I am applying here, the student actually performs a potentization in a lab. So under the supervised scenario, the student is able to give a succussion or trituration. So that is what shows how. Now the next is does. Does actually when a student is able to perform the task independently in a real life scenario. That means it is a learner applies the skill independently in a real practice. So here, if a doctor, once he passed out, a competent doctor, he confidently prepares and prescribes the medicines for the patients in his clinical settings. He is able to do some succussion methods in his clinic, in his dispensaries. So then he became a competent. So this is a level of Miller's pyramid, level of competence. Now, next is the categorizing, classifying each SLO by Bloom's taxonomy and Hubert levels. So here, I told that not going in detail about the Bloom's taxonomy, but having a very basic understandings of Bloom's taxonomy. We know that Bloom's domain is classified into cognitive, psychomotor, and affective domain. And all of you know that what it means. So, cognitive means domain means it is about the knowledge and thinking. Knowledge and thinking. The work done by the brain. So it is an intellectual aspect, as you said. So what learner knows about it, understand or reasons out. So we all know that there are 6 layers of Bloom cognitive domain. So that can be remembering or recall or understanding, applying, analyzing, evaluating, or creating, etc. So these are the different levels. So I'm not going in detail about these levels because it takes long time to explain all these things. Now, an example is if a student is able to explain about the Hahnemann's theory of chronic miasms, and this what is a chronic miasm, enumerate the different miasms and what are the indications for miasm, that is understanding level. The first one was the recall level. Then he applied the knowledge of his miasms in any cases. So he is going from a remembering or recall to the creating or evaluating. So if a student is able to explain Hahnemann's chronic miasms, and if he can able to apply it any case analysis, then it achieve all the levels of cognitive domains. Now about the psychomotor layer. So psychomotor, we know it is about the motor activity or the practical skills. So it means it refers to the physical and technical skills. So what a learner can perform with their hands. So according to Bloom's, it can be 6 levels from in imitation. So what a instructor does is a learner will imitate it initially, then manipulate it. So manipulation means performing with the guidance, with the help of the facilitator. Now precision. So he may not have precision in the manipulation, but later he becomes a precise learner. Then he becomes a precision will acquire. So accurate, independent performance will be the result of the precision. Next, articulation. So here, combining many activities in a coordinated manner. That is what is called as articulation. So here a learner is able to mix or he can mix many activities together in an articulated manner, coordinated way. So that is what is called as articulation. And next level of psychomotor domain is the naturalization. It becomes a routine, mastering the skill so that it becomes a routine. So that is a level a learner has to achieve. So that is a different layers of psychomotor domain. Now coming to the, so if you're asking me about some example for this psychomotor domain, suppose a learner learns the method of potentization and or the method of preparation of mother tincture and demonstrate potentization with precision. So this is the evolution of a learner from a imitation to naturalization. Now next level is affective layer or affective domain. which gives attitude and values. So that means this covers learners' professionalism, ethics, empathy, motivation is very, very essential for a medical profession. And how they feel and how they behave in a professional life, which is there in the affective domain. So this also having certain levels, starting from receiving. So here the receiving means the learner is able to receive whatever willing to listen. Suppose during case taking, the person, the learner is able to, he's having a capacity, ability to listen what the patients say. So that is that quality is the receiving. Now responding, actively participating in the discussion, valuing, showing some commitment and respect to the patient and the peer groups, and then organizing. So here, prioritizing the value, resolving the conflict without having any conflicts. How he is applying the values to the practice of profession. So that is where the organizing acts. Now characterization. Characterization, these values become internalizing and becomes a character of the professional. So that is very, very essential for a medical graduate. So these are the different domains and its levels of. So suppose, for example, as a homeopathic student demonstrate empathy while taking patient case, and he shows some ethical values to that patient, then that reflects the affective domain of that learner. So this is what we explain it by Bloom's taxonomy. Now categorize SLOs as must know, desirable, and nice. So here we are prioritizing the topics into must know, desirable, or nice. So and it depends on the how often we are come across the different topics in the course, and what is the relevance of the particular topic in achieving the course outcome. So depending on that, we categorize the SLOs into must know, desirable, and nice. Now select an appropriate teaching and assessment method for each outcome. So I'm not going to discuss about the teaching and assessment methods now, and integration also. Now all of you have seen this in the competency table, the serial number, competency, Miller's level, content, SLO, domain, priority, then teaching learning method, assessment and formative and summative, then integrations. So I think these I have explained it. Now this also I explain it, the difference between generic competency and specific competency. So as I said, general competency is a broad attribute, whereas specific competency is a focused ability within a defined domain. For example, in a cognitive domain, there will be a specific competence. For an affective domain, there is a specific competence. So, and the general competency again, it ensures the overall professional quality adaptability, whereas specific competency develop discipline-specific expertise. So these are some differences between generic and specific competence. So why I have given this slide, because many teachers share their concern over how to read the competency table, and what are the terms, the meaning of the terms and the differences. Now this also we have explained it properly. I think more explanation is not needed. So I have given some examples from the pharmacy point of view. So now list any, for example, from the drug from particular part of the plant. So that is about the knowledge. Now apply this knowledge, apply the guidelines, lay down the official pharmacopoeia with respect to the identification and collection. Now shows how demonstrate care while identifying and collecting of the plant drug substance. So he is showing the skill. Now identify the plant and its parts used for preparation of homeopathic medicines. These are the levels of competency. I have already explained it. Now, there is another word, Goldberg's triad of layers mapped with Bloom's domain. So We all discussed about the cognitive, psychomotor, and affective domain, and what is the role of these domains in understanding the SLO. Even when we write the lesson plan, it's very essential. And even for the assessment also, teaching learning method also, these learning objectives are very important. Now, prioritizing the educational content. So I have explained it with some examples. So priority is based on the impact. So how the topics are classified into must, desirable to know, and nice to know. It is based on impact, that is the significance, and the frequency. That means how often it is encountered in the course outcome. And impact is the significance of this particular topic in the course outcome. So depending on these two things, so priority is impact multiplied by the frequency. So that is a mathematical calculation to prioritize each SLS. So must know, I have given one example from drug proving topic. Explain the methodology of drug proving. So methodology should know, must know for all the graduates. Desirable to know, select ideal prover of drug proving. If a graduate having a knowledge of how to select an ideal prover, that is desirable. Whereas if a graduate is able to design a protocol for drug proving, so we know that we have a protocol, CCRS protocol. So if a graduate can able to provide a new protocol, a better protocol, that is nice. So that is the level of knowledge or prioritizing the educational content or the essence. Now, with this, I am concluding the glimpses of competency-based dynamic curriculum and its certain features of this curriculum. Now, coming to the textbook, the D.D. Banerjee's augmented textbooks of homeopathic pharmacy, the 4th edition, and I am happy to declare that, or it's already announced by Dr. Nouri. We are going to launch a revised edition or a revised 4th edition in 2025 with certain changes. With we come across the challenges we come across after introducing or implementing the CBDC curriculum with respect to the content as well as some restructuring of the topics. And definitely we include certain new things, especially in the drug proving, certain new methodologies or new quality assurance systems in drug proving. So that we have introduced some new technologies or techniques are introduced in drug proving. Then we have corrected certain source in the source that is very difficult to get the correct source, because many textbooks give vivid sources. Even in pharmacopy also certain mistakes are there. So we try to rectify all these mistakes, the new revised edition. Then with regards to the content, we have omitted certain content and we revise the contents. So it is with a simplified language enhances understanding of complex homeopathic pharmacy concept to be made the language as simple as possible for students. Then clear, concise explanation makes the material engaging and accessible, and rich visual aids including chart and illustrations are added, support comprehension. Then one more thing is online resources which can access with the QR code. So now in 2025 edition, we are adding a few more resources which are online available through online when we scan this QR code, which is not able to put in this textbook, because we know that the content is very if it is the content is very large, it is not able to put in one textbook. So that's why we start with the online resources. which a student and teachers can assess as well. So the plan and structure of the book is not changed as much, but certain things are added. In Unit 1, Man, Medicine and Pharmacy, Pharmacy and Pharmacopoeia, Pharmacology, Pharmacognosy, Pharmacodynamics and Experimental Pharmacology, Origin and Sources of Homeopathic Drugs, Process of Collection of Drug Substance, Packaging and Labeling of Homeopathic Medicine, Preservation and Potencies of then role and contributions of pioneers in the development of homeopathic pharmacy. Unit 2 is about the vehicles. So solid, liquid, and semi-solid vehicles are given in separate chapters. Unit 3 about the lab methods, then instruments, cleaning, first aid, etc. Unit 4 about the metrology. Then Unit 5 is about the preparation of drug in general. And in this chapter, we have given certain changes. The scales of drug preparations are introduced in 5.2 chapter, and potentization of homeopathic medicine is introduced in 5.9 chapter. And the last chapter, industrial pharmacy and good manufacturing practices, also introduced. So it contains the German pharmacopoeia method, then HPUS method, etc. Then Unit 6 is about standardization, specific methods, and also contains a Pharmacopoeia Commission for Indian Medicine and Homeopathy. Then drug standardization units of CCRH, and the important works taken up by the CCRH under drug standardization and drug verification. Then chapter Unit 7 deals with the principles of homeopathy and its application in homeopathic pharmacy. That is the drug medicine remedy concepts, posology, prescription, medication, dispensing, pharmaconomy, external application, hospital pharmacy. So these are included in chapter 7, Unit 7. Now, drug discovery process is placed in Unit 8, that is the drug proving Hahnemannian method, and homeopathic pathogenetic trial is elaborated with so many new techniques and technologies. Unit 9 deals with the pharmacological action of important drugs, and it also includes the phytochemical constituencies. Then pharmacological terms also included in this particular unit. Unit 10 about the pharmacovigilance. Now we know that pharmacovigilance have gained a lot of popularity in Ayush, so also in homeopathy. So we have included many new things in pharmacovigilance, especially about the ADR concepts of material drugs, crude drugs, raw potencies, patent drugs, combinations, etc. And drug safety with reference to HPI. Then Unit 11 deals with the legislations pertaining to homeopathic pharmacy, then conduct and activities. Unit 12, scope of homeopathic pharmacy in relation to anatomy, physiology, metrimedica organon, anatomy, veterinary sciences, agro-homeopathy, and allied sciences. Then the doctrine of signature. Unit 13, which is a newly introduced concept in CBDC, modern theories related to homeopathic drug action. Remember, all the modern theories, all the hypotheses are not included. Whatever is authenticated with the research have introduced in this chapter. And also the introduction to nanomedicine, molecular mechanism of drug action, etc. are included. Then scope of research in homeopathic pharmacy related to new drug discovery, then preclinical researches, then scope of veterinary and plant researches. And the last chapter is the development of homeopathy in India, plant collection and herbarium preparation, then history and authority of the plant kingdom, drugs and their local names, which is taken from the pharmacopoeia itself, then table of drugs, abbreviations, indigenous drugs, preparation of drugs, identification. And now we are going to introduce a glossary of terms also, so that the learner or the reader can easily assess the term in the textbook. So the page number also will mention. So this is about the content, the plan, and the structure of the book. And I opened this session for the interaction. Hope this interactive session will enhance the knowledge among us, and the ultimate beneficiary is the students. And I also expect your feedback to improve the textbook in future. I mean, in this edition also we can incorporate your suggestions and your additions. Thank you all.
Audience, if you have any questions, please put it in the Q&A box and we'll try to take them in this session. Thank you so much, sir, for walking us through the highlights of the 4th revised edition of D.D. Banerjee Pharmacy. Your efforts in aligning this edition with the CBDC will undoubtedly serve as a valuable academic resource. Given the success of this project, sir, would you mind telling your insights about the work which we at Homeopathy 360 are doing to keep the global audience of homeopathy updated about the work done?
Your work, BJ 360, you have been working for many years in upholding the quality of homeopathy, homeopathic graduates, and homeopathic practice globally. And with respect to homeopathic pharmacy, especially last year also I have given one small session on this textbooks, the newly added curriculum notes. And this will help the faculty throughout the nation to interact within ourselves. And the insight what we accumulated after a brainstorming discussion. So all teachers or senior teachers, I will able to improvise the content of the textbook. And it is the contributors. I can always say that the contributors' effort is priceless. So what not me, any editor can do is to assimilate the contributions made by the fellow teachers. So that's what I always listen to the words of respected teachers. So I'm expecting more contribution from the teacher's side, and also I'm getting more valuable insight from students also. I have many chances. Last week I went to Calcutta for taking a session on CME for teachers. So there also I could get some insights. So even for students, from the students also we get many things to add. So I request teachers to ask questions, then share your experiences and your valuable inputs in improving the book as well as the curriculum.
Sir, we have received one question from Dr. Atul Kumar Singh. He is asking, in vitro and in vivo protocols, are they added in the new revised edition?
No, in vitro as such is not added. In vivo, actually, in vitro, some small paragraphs are given, but not in detail, because we know pharmacy textbook, as you know, this book, it has almost 810 pages now. Now, if you add in vitro analysis, it will add surely 20 to 30 pages. If you add in vivo in details, the pharmacological screening, so there are many models like anti-inflammatory, analgesic, psychopharmacy, gastroprotective, then hepatoprotect. There are different models. If you add all these things, it will be like another text. So what we can do is the essential thing which is required for a drug discovery. So that is, I think it is added in the 13th chapter, chapter 13. It is added, and also in the experimental pharmacy. That is in the first chapter, it is added. Okay, the basic things are added, but the preliminary screening methods or in vitro analysis, drug discovery in detail, and the what you call as preclinical trials, it will be a bulky book, which is not serving the purpose of an undergraduate.
Right, sir. We have another question from Dr. Pranav Shah. He is asking, is the pharmacology part covering the 30 drugs as per CBDC?
Yes, yes. The whole drug which is given in the curriculum is added. And also, there are other drugs which are already there in the old syllabus that is also kept. We have not removed it, but all the drug which is newly added is incorporated to the test.
All right. Dr. Madhusudan Sahu, she's asking, hello, sir. Is there any plan to publish a separate handbook on application of CBDC for each practical topics of pharmacy as per NCH curriculum?
Yes, yes. We are in the process of introducing a practical book also. There are some contributors for helping us to in this direction, and it is like how to conduct DOPS, the direct observation, then OSPE, how to conduct OSPE examinations, then all the practical things which is demonstrable as well as the practical things which is incorporated. Definitely that will be a supplement to the main textbook. It is not included in this textbook, but it will be a separate practical test.
Really appreciate, sir. Thank you, audience, for patient listening and active interaction. Until next time, stay informed, stay inspired, and as always, keep leading the conversation with Homeopathy 360. Thank you, sir, for your precious time and wonderful insights. I hope the book comes and the faculty and students get the best out of it. Thank you, everyone.
Thank you all.